Hello, my name is Emily Cook, and today I'm going to be talking about pitted keratolysis. So, pitted keratolysis is a superficial skin infection mainly caused by the bacteria Keratococcus cnidarius. It typically affects the soles of the feet or the areas that have the most pressure bearing. It can affect the palms, but those are very rare cases. Some of the symptoms are smelly feet, white patch of skin or a patch that's lighter than the natural skin tone of the patient, pits or tiny indentations in the skin. These pits can cluster together to form a sore or lesion, and itchy sensation on your affected skin. So how does one get this disease? Well, some of the factors are hyperhidrosis or excessive sweating of hands and feet, prolonged use of occlusive footwear, so wearing enclosed shoes all the time or not changing out those shoes that you wear, increase in skin pH, living in a humid climate that oftentimes will have higher risk. Individuals who live in humid climates have higher risk of this disease, poor foot hygiene, obesity, and immune deficiency. Who's affected? So anyone can be affected of any age group by this disease, but it's more common in adolescents and young adults. It's also more predominantly found in males. One of a study that was conducted by 41 pitted keratolysis patients, 24 of these patients were male and 17 were female. So that's over half of the patients were male. So Keratococcus cnidarius is a gram-positive bacteria. It's also cockeye shape, so it's shaped in like a little ball. And also, so one of the unique things about this bacteria is that it will form colonies in a tetrahedral shape, so very quite organized, as we can see from these pictures. It's not mobile and has no phalangia to be able to move. It's strictly aerobic and it doesn't form any spores. It thrives in environments that are moist and moderate temperature, so and often it can be found in marine environments. It's also really it's part of our skin's normal flora, so it's already on our skin. It can be found on our feet, normally. So what makes it kind of like makes it pathogenous or can cause an infection? Well, so it does secrete an enzyme. This enzyme is called serine proteases, and it has two types, P1 and P2. And so this protein digests the keratin and dissolves the stratum corneum, which is the horny layer of our skin, the most protective layer of our skin. And so one of the cool important details about this enzyme is that it has a cleavage preference site, and this cleavage preference site can only be found in our human keratin. So it loves our skin. And so how does the pathogenesis of this disease? So the bacteria will bind to our skin cells and thus will start secreting the either P1 or P2, and then P1 or P2 will bind to its preference cleavage site and start breaking down the keratin and protein in the stratum corneum. So basically, it will start eating away at the enzyme will start eating away and forming those distinct indentions or pits, and thus allowing the bacteria to grow more. And so they'll start lining the tunnel walls. And so that part, when the bacteria is on the tunnel walls, it's quite very not lethal. It's not lethal at all, but once it does kind of get to the base of the pit, that is when it can rise to problematic because it's closer to the dermis where all our nerves are at, and so it can cause more of a lethal. And so, why does it stink? How do we get this like funky smell from this? Well, the reason why is because the odor is linked to the production of sulfur compounds. So the keratin, when the enzyme is breaking down that keratin, it will produce this sulfur compound, and so that is what the smell comes from. It's from the release of sulfur from our skin. Okay, so how do we diagnose this? Well, it's fairly straightforward. Doctors will usually diagnose this via symptoms and just from looking at the patient's affected skin areas and see those clear pitted areas of the skin. And so those are a clear indication of the pitted keratolysis. However, in some cases, it's not seen, can't be seen visually. So, for example, my brother, he does have this disease, but when his feet are dry, you can't see the little pits or holes in his skin. It's, they're only seen whenever his feet are wet, such as like coming out of a pool. That is when the holes become distinct, and that's when you're like, oh, you have this disease. And so thus often sometimes lab diagnosis is used, such as wood lamp examination. As we can see from the top picture up there, we have the distinct orange fluorescent lighting of a wood lamp examination. Skin biopsy, skin scraping, so they'll scrape off some of the affected area and send that to testing. Culturing, it is actually the bacteria is very easy to culture. Which is kind of why we do know so much about this disease. Okay, how do we prevent this? So good foot hygiene first and foremost. So washing your feet, using antiperspirant spray on your feet, also spraying it in your shoes, which that leads to a decrease in possibly having bacteria to grow. Also wearing cotton socks, this absorbs sweat. Those socks will absorb sweat. Changing out shoes and socks, so changing out your shoes once yearly, not always, especially your tennis shoes or any athletic shoes, changing those out most definitely. Also changing out socks. Also maybe changing socks out instead of just wearing socks from day to night, changing them out, not wearing this from midday. So changing from morning to midday and then having a new pair of socks on. Also just managing hyperhidrosis symptoms is one of the key ways of preventing this disease. So to treat this disease, topical antibiotics are typically used, such as clindamycin, erythromycin, mupirocin, and futastic acid. Antibiotics are really prescribed, especially penicillin, because this bacteria is actually immune to penicillin. Yay! So topical antibiotics are often prescribed to treat this disease. Another prevention, some other agents are benzoyl peroxide. This is typically an acne treatment gel, and so this is only prescribed when it's a very mild case of pitted keratolysis and not really extreme. All right, and that is my presentation. Thank you so much for listening. Here are some references, and thank you so much.